Welcome back. So the Health Department and Correctional Services are reportedly at odds over who should be responsible for some patients who are being kept in prisons rather than being treated in psychiatric hospitals. These are people who should be declared mentally unfit to stand trial or be held criminally liable. Ground Up reports that the number of state patients in prison has increased significantly over the past year. But for more on the story, we're joined by the Director for Mental Health and Substance Abuse at the National Department of Health, Dr. Dudu Shiba. Dr. Shiba, a good evening to you. Thank you so much for joining us. There's so much for us to get into. But perhaps we can start off with, if you were to bring us up to speed with the sort of interactions between the Department of Health as well as the Department of Correctional Services around these mental health patients that are unfit to stand trial or be criminally liable, that are reportedly in prison instead of psychiatric wards, the data that you have and the interactions that you've had with the Department of Correctional Services.
No, thank you very much for having me. Maybe let me start by being clear that we are not at odds. We are very much clear that state patients are patients and they belong to the Department of Health. So there is no question about that. Maybe let me say we have got a lot of state patients in the country, close more than 3,500. Actually, the number that we have now is 3,675. And 91% of those are in our psychiatric hospitals. They are with us, maybe let me put it like that, as the Department of Health. But we have just below 10% that are in correctional services facilities. And this is where the problem probably is coming out of. But maybe let me also indicate that most of this problem is in the Eastern Cape and Mpumalanga, and we have it also a little bit in Gauteng as well as in Northern Cape. We had a problem in Free State. It keeps coming back and going, but I think we have addressed it a lot in Free State. So it's not all provinces, and almost 50% of the patients that we are talking about are in the Eastern Cape. And not because we like it to be like that, but I must say that we have had a lot of demand or coming in of people who are declared state patients in Eastern Cape, for an example. And it's alongside the high crime rates that are happening. I mean, that province is having high crime rates, high murder rates, you know, all those things, and also the issues of poverty, you know, and mental health. All these things are linking up. So we are having a lot of them coming in, but we don't want them to be in prison. And we are admitting them. And I must say, we have admitted even more in terms of the past years. For an example, in 2022-23 financial year, we admitted 252 state patients, new state patients that we brought into our system. We increased the number in 2023-24 to where in 2024-25 we brought in 408. The number is increasing as the demand is increasing, and we are continuously admitting them. And I must say, there will always be state patients in correctional services, because when somebody is declared a state patient, they don't move from the court directly to the hospital. There are administrative processes that need to ensue for the person to be, you know, admitted administratively. So those processes take about 1 month, 28 to 30 days for them to be concluded. And by law, the Criminal Procedures Act as well as the Mental Health Act indicate that at that time, when all those processes are in place, those patients will wait in correctional services as we conclude the processes. But then we must be first to admit that we are having, a problem whereby now these patients stay longer than a month, where instead of, within that time being transferred to psychiatric hospitals.
Well, obviously, Dr. Shiba, the question becomes why we're seeing that happening, because you started off by saying that as a whole, in terms of these state patients that are, as you say, should be under the umbrella of the Department of Health because they are unfit to stand trial. We're talking about 3,500. You say less than 10%. Less than 10% would be about just below 350, which is quite a substantial number of mental health patients that are in prisons instead of health facilities. So talk to me about what the backlog is, because you've got the Minister for Correctional Services who says that he's written multiple letters to the Department of Health, getting very little response. This is what also is being reported by Ground Up, saying that this has also led to 690 million rand of overspending due to the legal obligations for the Department of Correctional Services. So this is costing the balance sheet of correctional services. Why are we seeing these delays, and what's being done to mitigate that?
No, thank you. Let me indicate that, yes, the department did get some correspondences, but not from the ministry per se, but from the Judicial Inspectorate, a Judge Inspector Cameron, who wrote to the minister. And there was also correspondence from the National Commissioner to our DG regarding the same matter. And yes, it is currently 362 for the whole country, not just for one province, and 3,675 are with us in the health sector. As I indicated earlier, that within this 362, it's not all that are more than a month. Some, for an example, you'll have a few here and there who are waiting for administrative processes. But let me indicate that it's a myriad of problems or of challenges that are leading to this. It is not just that it is beds. Maybe let me indicate that when we discharge a state patient, it is not the department, it is the judge in chambers who needs to discharge the state patient. Therefore, when we have treated, our teams have treated and they have satisfied themselves that this person is now ready for discharge, either conditional discharge or full discharge, or sometimes applications for reclassifications. There is sort of like, we find that there is some sort of reluctance, from the justice or from the courts, from the judges to release that person. And we have had a serious problem of throughput. We are lacking the throughput, that is, we are not able to take out people because we are not being granted the right to discharge. But then there are people who are needing space and needing to come in. So to address that, we are strengthening intersectoral collaboration at provincial level, also at national level, through intersectoral forums, so that we are able to engage each other. And we are also working on a strategy. In fact, for those provinces that have got these problems, we have developed plans together with them. That is why we are seeing the increasing number of the people that we are able to admit and take in. But the number somehow, it gets back, because now the demand is even more coming in. And then it makes it as if we are not moving. And yet, if you look at the numbers that we are admitting, we have created space. We have got also infrastructural projects in Mzimkhulu, in Fort England, Free State, whereby we are increasing the capacity. Hence, we are seeing more people that we are able to bring in. In Eastern Cape, I must also indicate that this type of patients that we are talking about have got some level of risk, and therefore they need qualified or capacitated or skilled people to be able to look after them. Yep. Your psychiatric nurses and all. We're having a problem with psychiatrists in Eastern Cape because of its rural nature. But we have recently been able to bring in psychiatrists through international recruitment, and it's all those efforts that are working towards addressing the problem. And we have introduced a number of other interventions where, whilst they are waiting in correctional services, our psychiatrists and our teams go see them there, whilst waiting to bring them in, so that we start in treatment and we make sure that all the treatment that is needed is started even whilst they are waiting in correctional services.
I can imagine that you, like all South Africans, are aware that one of the biggest blights or blotches on our history on the country is the crisis and the tragedy of life esidimeni. And the treatment received by vulnerable mental health patients who were handed over to non-profit organizations. Now, can you clarify this for me? Is the Department of Health looking to contract non-profit organizations that are set to take on these? This is now reports that I'm seeing here in front of me, that the department is allegedly looking to contact non-profit organizations to accommodate state patients that do not have space within the Department of Health's facilities and subsequently are then languishing in our prisons.
No, maybe let me correct it like that. I indicated earlier that there will be a state patient and the time will come, probably this person is old, this person is sick, and we apply for reclassification, or the time for discharge has come, but we still have problems where families don't want to take their loved one back. They are no longer patients. We feel that we have treated them and they are fine. They can move out so that we open space for others. But families are reluctant to take, or families are not available to absorb, to take them back to their homes. So we do have, remember, when we bring in life esidimeni, we are talking about the situation that happened outside the ambits, and we are talking about the situation whereby people were taken to unlicensed NGOs.
Correct.
Now we do have licensed NGOs, and by the way, we have recently concluded the regulations that is strengthening licensing of NGOs, and those NGOs we are not looking at them taking patients. We are looking at them taking in people who have not yet been accepted by their families, but they are ready to be discharged, and we are satisfied that they have been treated and healed. So it's like places, like homes for them, yes. Okay. So we call them reclassified. They are no longer state patients. They have been reclassified, or they have been discharged from being state patient, just to move them away from a locked up environment when they are no longer supposed to be locked up.
Yeah. Just one final question then, Dr. Shiba, and that'll be the Minister for Correctional Services, Peter Groenewald, quoted as saying, if the minister responds tomorrow and says send them, we will send them almost that same day. So time frames on when we can see the resolution on what happens with the 362, particularly those that should already have been under the ambit of the Department of Health.
No, thank you very much. I must say that it's not a static number, a pool of 362 that are waiting. So we are admitting, for an example, this month in April, we admitted 30 of them. So as we are admitting, new people are coming in. We are admitting, we are taking in, and then new people are coming in. So as I indicate that we have put in place plans, and we are actioning them, and we are admitting, and maybe let me say, just between January and March, we admitted 90 of them in our facilities, bringing them in from correctional services. But as I'm indicating, there is a lot of influx or people coming in that are being declared state patients. So as we take others in, others are coming in. So it's not like there's nothing that is happening. And I must indicate that there is a lot that we are doing, and it is already paying up and it is showing up. But we also have problems with Mpumalanga as one of our provinces that is without a specialized psychiatric hospital that is being, through legacy, is being assisted by Gauteng Vescopis Hospital. Now Gauteng already also has its own push. So all these things are at play, but we are happy that there are plans in place for building a new psychiatric hospital in Mpumalanga, whilst other things are happening on the side. It's not like the department is happy and is waiting, but there is a lot that is happening, as I'm indicating that today we are admitting, tomorrow we are admitting, but more people are coming in because it is not a pool and static that we are just going to be extinguishing and then that is all.
All right. Well, we thank you so much for your time. Dr. Dudu Shiba, there is the Director for Mental Health at the Department of Health nationally, that is.